Hey everyone, my name is Avi Desai and I am a high school student. Today on my YouTube video, I would like to talk about diabetes. Diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. Now there are two types of diabetes. If you have type 1 diabetes, your body does not make insulin. Your immune system attacks and destroys the cells in your pancreas that make insulin. Type 1 diabetes is usually diagnosed in children and young adults, although it can appear at any age. People with type 1 diabetes need to take insulin every day to survive. Type 1 diabetes is also hereditary. One known celebrity with type 1 diabetes is Nick Jonas. If you have type 2 diabetes, your body does not make or use insulin well. You can develop type 2 diabetes at any age, even during childhood. However, this type of diabetes occurs most often in middle-aged and older people. Type 2 diabetes is the most common type. Now for some statistics. According to the CDC, of the estimated 23 million people with diagnosed diabetes in 2015, about 193,000 were children and adolescents younger than age 20. The increasing frequency of both type 1 and type 2 diabetes in young people is a growing clinical and public health concern, and it is of utmost importance to make sure that our children are getting the correct diet and getting at least 1 hour of exercise to maintain a healthy weight to reduce risk of diabetes. In an experiment, investigators identified youths under 20 who were diagnosed with type 1 diabetes and type 2 diabetes from the years 2002 to 2012. All 5 major racial and ethnic groups in the US were included. For both type 1 and type 2 diabetes, the rates of new cases increased. For each year, the rate of new cases of type 1 diabetes increased by about 2%, and the rate of new cases of type 2 diabetes increased by about 5%. The rate of new cases of type 1 diabetes increased by 4% per year in Hispanic youths, 2% in non-Hispanic blacks, and 1% in non-Hispanic whites. For type 2 diabetes, the rate of new cases rose by 8.5% per year in Asian American or Pacific Islanders, 6% in non-Hispanic blacks, and 3% in Hispanics. For whites, the rate really didn't increase significantly. However, the rate rose about 9% annually in Native Americans. The researchers also observed differences between genders as well. For type 1 diabetes, the rate rose more among males than females, but for type 2 diabetes, the rate rose more among females than males. Now, it is possible to manage your diabetes once diagnosed. The National Institute of Diabetes calls this management managing your diabetes ABCs. The A stands for the A1 test. The A1C test shows your average blood glucose level over the past 3 months. The A1C goal for many people with diabetes is below 7%, but it is recommended by the NIH that you ask your doctor what your goal should be, because everyone is different. The B stands for blood pressure. Most people with diabetes have a blood pressure goal of about 140 per 90 millimeters of mercury. The C stands for cholesterol. Now you have 2 types of cholesterol in your blood, LDL and HDL. LDL, also known as bad cholesterol, can build up and clog your blood vessels. Too much bad cholesterol can cause a heart attack or a stroke. HDL, also known as good cholesterol, helps remove bad cholesterol from blocking your blood vessels. Ask your healthcare team, your doctor, what your cholesterol number should be. And finally, the little s in the ABCs stands for stop smoking. Not smoking is especially important for people with diabetes because both smoking and diabetes narrow your blood vessels. Blood vessel narrowing makes it harder for your heart to beat. E-cigarettes aren't a safe option either. Not to mention, quitting smoking also lowers chances of getting several other diseases, such as heart disease, lung cancer, and other fatal diseases. Another thing someone should do is to exercise at least an hour daily. This will help maintain a healthy weight and reduces risk, as being overweight cues risk to diabetes. So this can help with treatment or can help with preventing it. Remember, I am not a doctor. I am simply a high school student that wishes to spread as much information to as many people as I can. It's important to always consult with your doctor before, during, and after treatment or diagnosis of diabetes. The most important thing that you should do, whether you are diagnosed or you're trying to prevent diabetes from occurring in your body, is to stay positive. Thank you for listening.